Thank you for joining me. My name is Evelyn Knight, and this is the Child Care Business Coach podcast. I do have some very important and timely material for you. If you're listening to this in the future, it is April of 2020, so we are right in the middle of the COVID-19 crisis. The information in this episode is very, very important. We do talk about disaster preparedness, how to be ready for a pandemic. You really need to keep in mind is being ready for any kind of disaster. In our lives today, we are surrounded by what's going on with COVID-19, and the entire world is really going through this at the same time. But what we need to remember and keep in mind is that there is always a disaster somewhere. They're just normally regional, and we don't usually experience them at the same time, but we all go through something eventually. So being prepared and always proactive is so very important. During this time, if there's one thing that we take away from this as a society, things can happen at any time, and we need to have plans in place, and we need to really be proactive instead of reactive. So I really hope you enjoy this interview, and join me on Facebook, the Child Care Business Coach. I'm going live almost every day trying to bring you relevant information. So we will get into the interview, and hopefully I will get a chance to chat with you on Facebook.
Welcome, and thank you for joining us today. I am with Andrew Roszak, the Executive Director of the Institute for Childhood Preparedness. Thank you for joining me today, Andrew. Can you tell us a little bit about yourself and your organization?
Sure, absolutely. It's great to be here today. I'm with the Institute for Childhood Preparedness. We work every day to help make early childhood programs better prepared for to respond to and recover from emergencies and disasters. So I've been working in emergency preparedness for over 20 years. I actually started my career as a firefighter paramedic and have been working at all levels of government, from the state to the local to the federal, even in the United States Senate for a couple of years, working on emergency preparedness policies and plans. And I've been working in early childhood for the last 6 years. So our daily mission is to make sure that early childhood programs have the tools and the resources and the knowledge they need to help keep everybody as safe as possible.
Yeah, I was looking at your website. You offer a lot of great information, a lot more than just what we're going through now. So for future reference, I noticed like you have an active assailant training and some really great resources in there. So for my audience out there, check out the website. It's actually pretty cool. And I will put all of your information in the show notes so people know how to find you and your website. But today we are, of course, going to talk about COVID-19 and how we as childcare centers can better keep our staff and children safe, and the really heavy decisions we need to make during this time. So I want to start with what we were talking about a little bit before I recorded. Let's start at the beginning, where I think there's a lot of misperceptions out there about why this virus is so bad. I see a lot about like the H1N1 and how we didn't react to it the same way about the flu. And I know the sense out there is that we're overreacting a lot. Can you tell us a little bit about why why we're not overreacting and why this is different?
Yeah, absolutely. So, one of the interesting jobs I had a couple. One was with the U.S. Department of Health and Human Services in the Emergency Care Coordination Center, and I was actually there helping to lead the efforts during H1N1. So worked through all that pandemic and that outbreak. And then for 3 years of my life, I served as the Senior Director of Environmental Health, Pandemic Preparedness, and Catastrophic Response at the National Association for County and City Health Officials. And in that role, my full-time job was working with the CDC and the 3,100 local health departments to help them prepare for pandemics. So a lot of this stuff that we're talking about now is stuff that I've been working on, for the past, 10 years or whatever it's been as a public health professional. So, it's not surprising that we're seeing a pandemic. Those that have taken my emergency preparedness class, they know that I always have a slide and I talk about future threats. And one of them that we always talk about is pandemics. And we've been pretty much long overdue. I mean, the last real bad pandemic was 1918, and it killed literally tens of millions of people. So what's really different about this virus, this is an RNA-based virus. So it's similar to Ebola, it's similar to MERS, similar to SARS, and similar to the influenza that we get each year. But the thing about RNA-based viruses is that they love to mutate. So that's why we have a different flu shot each year, because that virus in the course of the year mutates. And last year's vaccine wouldn't be as effective as the new strain that's coming out, for this year. So this, as an RNA-based virus, this is kind of the coronavirus's best dream. It's infected millions of people across the world, and it has that opportunity with each new host to start to mutate. So currently right now, there's about 8 different strains of this going around the world. And the big thing that sets this apart from those other strains is just really how transmissible this particular virus is. Right now, the studies, what they call the R0 value, and R0's just a fancy public health term, but essentially it looks at how many people does one person with the virus potentially infect. And the average is about 2.5 people. So if you have the virus, and the scary thing that, we're finding more and more about this virus all the time, but the scary thing is now that a lot of people have this virus and they don't show any signs or symptoms. So they could be walking around just feeling healthy as all normal, and they're actually spreading this virus. Oh, wow. So if you think about every single person you come in contact with, you're potentially spreading it to 2.5 people, and then you start to multiply that out as those people go and talk to other people and talk to other people, you can really see how this thing can spread like wildfire. And it's a lot different than 1918 just because we're so interconnected. In 1918, you couldn't hop on a jet and, travel the world like you can today. So that's really the alarming concern, is how wild this is spreading, how quickly this is spreading, and then also the associated death rates with this for folks with underlying medical conditions. Some of the older folks that we saw from the early Chinese data, but even now as we see more and more people affected across the world, we're seeing that it's not just impacting older people. We're seeing a lot of younger people getting this virus as well. So a lot of factors that we don't know about. It's still a new and emerging virus. The COVID-19, as you hear it, CO stands for corona, VI stands for virus, and D stands for disease. And then 19 is the year in which it was discovered. So COVID-19 or coronavirus, same thing. But the big thing is it's a novel virus, one that we have not seen before. So we don't really have a lot of research. We don't have a lot of data. And much like the yearly vaccine, the vaccine for this particular virus is probably a good year away. So that's why you're seeing a lot of necessary measures to prevent the spread of it, because nobody right now has any kind of natural immunity to this, because we've never seen this particular strain of virus before.
Right. One of the things I also see all over right now is people are saying, well, on the back of a Lysol can, it says coronavirus. But I think it's important for people to know that this is a different strain. And I don't think people understand that. Just like the flu has several strains that come out every year, which is why we need a flu shot every year. This is a totally brand new strain, and it's nothing we've ever seen before. And I think that's another huge misperception, which is what's causing people not to really be safe. They're not staying home like they've been asked to, because there are really a lot of just misinformation out there right now.
Yeah, I agree. And we have to remember we call this public health. Okay, this is not individual health. So this is the public health, and we're doing this to protect the public. We're not doing this to protect you as an individual. Right. We can't be selfish during these times. And really, truly, the actions that you take as an individual are going to really make it or break it for the public. So, one bad actor in this, and there's a wonderful graphic out there. A company got a whole bunch of cell phone data, and they looked at one tiny little beach in Florida on the East Coast there, and they could see just how one tiny beach over the course of spring break, basically with cell phone data, everybody left that beach, and they went to all 50 states and Europe and everywhere else. So the impact of just one beach, one gathering, can really have worldwide implications. Yeah, it's really amazing. I'll share the link with you so you can put that out there to your friends as well.
It's all very fascinating. So I know on your website, I was reading one of the blog posts that you put, and that you are recommending that centers close at this time. So I want to talk a little bit about that and why you feel that way and what your opinion. And as you know, we spoke about this before. I'm currently open, but right now it's really, really hard. These decisions are so big and so heavy, and we really don't have all the facts yet. And it's making these decisions right now can be so difficult. So for centers like mine, is there a point that you would recommend that we do close? Like I was telling you, my city, we have no cases as of yet. I think the closest case is about 60 miles away. So what are your recommendations for centers that are still open?
Well, right. And of course, if you read the full article, as you did, I don't take this decision lightly, and I'm not naive. I've been working in early childhood for years. I understand there are going to have to be centers that remain open. As a firefighter paramedic formerly, I understand that some of our frontline medical providers are going to need childcare. But, I don't have a hidden agenda here. My agenda has always been to protect our early childhood workforce and to make sure that they're safe and as healthy as possible. And just right now, we're not able to do that. We're not able to assure your safety. This is a disease that many people are asymptomatic. They don't have any signs. They don't have any symptoms. Yes, the initial data out of China did say it was attacking our older population more, but we've seen that change through Italy and through Germany and France and now here in the United States. I was just reading about a very healthy 38-year-old police officer in Detroit that died of this. So, truly nobody is necessarily immune to this. The other thing is that children, especially young children, can carry the virus, and they do carry the virus. They are just as likely as adults to get infected with the coronavirus. However, about 90% of the adults that come in with symptoms are showing, fever and dry cough and headaches and those type of things, whereas only about 70% of the children who show signs and symptoms are actually showing the fever and the cough and the headaches and those kind of things. And there's a whole bunch, up to about half, if you look at some of the studies, about half of the people that get this that show no signs or symptoms at all. Okay. So my big concern is that we're caring for children. Children probably have this virus. Children could be silent spreaders and spreading this virus. And for those programs that employ, older adults or employ people with underlying health conditions like diabetes, like heart conditions, any kind of immunocompromised, situation, we could be putting our staff at risk. Right. So as I look through the landscape and I see Head Start and Early Head Start and K through 12 all suspending their in-person activities, kind of begs the question, well, why is childcare any different? Why are we being asked to step on the front lines? And if you think about some of the jails that are out there releasing prisoners because they can't control the spread of the coronavirus, I can't think of a more controlled environment in this country than a jail. And If you're not able to control the coronavirus in a jail, how in the world are you going to control it in an early childhood setting? So, those are the kind of the things that frighten me. I've also, I'm an attorney, and I've been watching some of the legal things that have come out. And just yesterday, I saw some folks that are now suing their employers, saying, "Hey, you made me work, and I got sick, and you knew better, and you're liable." Right. I also saw Walmart got sued. So as hard as it is, I do think if you have the option to close, I think as hard as it is, I think that's probably the safest thing that we can do right now until we learn more about this disease and until we can make sure that our early childhood workforce gets the tools they need. And by that, I mean, personal protective equipment, which we know is in very short supply right now. Hospitals can't even get it in some cases. So I know we're not going to get it. But it's just like SARS. It's just like MERS in the fact that it's an RNA-based virus. And we know from previous studies, SARS and MERS live in a child's respiratory tract for up to 22 days. And we know it can live in a child's fecal matter in their poop for over 30 days. And I know that all of us that work in early childhood are exposed to kids coughing, kids spitting up, kids pooping, all that kind of stuff. So, so all those things are concerning. So I'm not saying that with any kind of malintent. I'm truly saying that because I want to make sure everybody's protected and everybody's got eyes wide open on this. Right. And then I've also got, a 28-page document that we put together for those programs that do have to remain open on how they can be as safe as possible, understanding what we understand now about this virus.
Right. And I will link that in my show notes so that anyone who wants to go over that, because definitely making that educated decision is so important. And one of the first things I did when this happened, I called for a staff meeting and I did give my staff the option. I told them if they wanted to get laid off, I would honor that. And I had a couple high-risk employees and I brought them into the office and I actually did lay them off just because I felt that was the safest thing to do. One of them was my own mother. So I just knew, she's in that demographic. So it was one of the hardest things I've ever had to do was lay off my own mom. But I figured in the long run, it is for her safety. Another thing for providers out there who are in the same boat, I have had to recruit substitutes at this point. And I do basically lay out, this is, we are caring for children whose parents are on the front line. They're making sure, I even do have them sign something that they realize this and that they are still coming in and they're still choosing. And for the most part, the people who are subbing are about college aged, thought they were going to be gone and then came home because their semester got canceled. Again, before we were recording, we were talking about the NEEYC study a little bit about how 60% of childcare centers are predicted not to make it past this. And you did mention that your business too thrives on childcare, so you are affected by this also. Do you have any recommendations? I know that there is the PPP loan. It seems a little hard right now, but I still think it's worth going after. Do you have any other recommendations like that too? I think it's hard when owners that right now have that decision to make with our center's viability. Are we going to survive this as a company? And then also taking into account, are we spreading the virus?
Absolutely. And again, we're a small business. Our bread and butter is in-person training. So our staff, we've got 15 people that work at the Institute. We're in childcare programs and Head Start programs, after school programs every single week. So for us not to be on the road is really kind of odd. But again, we do in-person training. And I honestly, I don't know that we're going to be able to do any in-person training the rest of this calendar year.
Right.
So, for us, it's a struggle as well. We're trying to figure out how do we continue to get our mission and serve and get information out there to people in this time of crisis and still keep the doors open.
Right.
I have applied for the emergency loan, the $10,000 loan. Did that about 2 weeks ago. Haven't heard a peep back. Haven't got the money.
Yeah.
The government in Washington, D.C., where our business is based, provided $25,000 in funding. Again, I applied for that as well. Haven't heard a peep. And of course, the payroll protection program became available on April 3rd. That got off to a very rocky start. If you did not have an existing business account with a bank, they basically told you, hey, you're not eligible in our bank, so go look somewhere else.
Right.
I bank at SunTrust, I bank at Chase, I have an account at PNC. They are pretty slow on the game. And quite honestly, some of the folks that work for me are independent contractors. And as a result of the rules, they're not eligible for this program either. So
right.
I don't know. I totally get it, man. Everybody's struggling here. We're all in this together. And I wish I had the magic answer. I mean, I think it's a little unfair in a preparedness world. We tell people to save 2 or 3 months of salary to be a responsible individual. But yet you look at these massive corporations like, the American Airlines and Marriott and Hilton's and these places that are making millions and millions of dollars in profit a year. And somehow the money, they're not being held to the same standard that they should have 2 or 3 months of savings to, ride out an emergency.
Right.
I think the administration gets it. I'm seeing, it's just, and to think about a company like Boeing that, by their own actions was kind of suffering before the coronavirus was ever even discovered. To have them coming and bailing out because they made a plane that was having some technical difficulties, and then they're going to bail them out. I think we need to take a really hard look. Small business represents over 50% of the United States, and childcare is a $1 trillion business, I believe it is. I think it's $1 trillion, and it's about half in direct services and then half in just the stimulation we put on the economy through buying equipment and supplies.
Right.
So it's a huge, massive, I have been in talk with a lot of the leadership, other organizations that are out there. Congress is talking about a new 4th round of stimulus, I guess it would be. And the letter we signed on to earlier this week advocated for $50 billion in additional funding just for early childhood. So I do hope that we start getting some credit. Yes, we are not, in the front lines on the medical sense, but as you mentioned, we're caring for the front line. And if we're not there, they're not going to go to work.
They can't go to work.
And, much to your point, I've had provider after provider reach out to me. I had one in North Carolina reach out the other day and say, look, I'm scared. I'm caring for these kids. I know that they're more at risk of getting infected because of the professions that their parents do. And in some cases, the parents are coming to my program in full uniform or in scrubs or whatever, right from work to pick up kids.
Right.
And, and that's something that we've never seen before. So I do hope that we come together. I do hope we get the recognition that we finally deserve. And if society doesn't appreciate all the efforts of medical providers, public health officials, sanitation workers, grocery store workers, truckers, and of course, early childhood, when this is all over, then I think we've really missed our opportunity. I will say Senator Schumer put an idea out yesterday that any essential worker should get at least $25,000 as a bonus. I did not see him specifically say early childhood, however, in that proposal. But I really do hope that somebody gets his ear and amends that so that we're counted in the essential workforce, because we really are at the end of the day, as you know.
Well, and for all my listeners out there, send them an email. And we can email. And that it brings up another good point that we hadn't actually discussed. Now is the time for all of us to start advocating. Now is the time for us to get, email your local news channels, let them know what you're doing, even if your center is closed. We need to bring that attention nationwide to what we're doing and our efforts and the work that we do, because America cannot go to work without us. And I know I did a podcast in Canada, and it's the same thing there. It's not just the United States. The world really relies on childcare, and we know the importance of that quality care and right now. So, and we're not in a society any longer where people can just take their children to their neighbor's house or grandma and grandpa's house. And right now, you probably don't want to take them to grandma and grandpa's house. So it's something that we can really get the word out. But us as a workforce, we need to do that work too. We need to get our voices heard. And right now is the time for us not to just sit back, but to be heard, to, write letters to your congressman and really just start working on that advocacy piece.
Yeah, 100%. And many of us have some extra time right now. So I would encourage you to become familiar with your politics. And, the other thing I think has been interesting, we've got a map on our website, and it tracks who's mandated childcare closed, who's open childcare programs for essential workers, who's actually providing incentive pays for childcare during this time of need, and a couple other things. So check out our website, childhoodpreparedness.org. We've got those maps, and we're updating them every couple of days. But one of the things I think is interesting and probably worth a discussion as we start to get past coronavirus in the future is, like the state of Nebraska. If you look at the state of Nebraska, they took some pretty sweeping action on childcare. And basically, to sum it up, and this, I'm not going to go into all the nuances of it, but essentially the theme is kind of like, if you want to open a childcare business right now, just open one up. And they've kind of waived, so they're waiving a lot of the rules and regulations. And I know some states are doing that as well. But to your point about advocacy, we've got years and decades of research and proven techniques. Now is not the time to get rid of health and safety requirements. What we need now more than ever is quality childcare that's safe and of the highest standard. This isn't something that we're just going to waive regulations because it's a hurricane in 2 or 3 days or a week, life will be back to normal. We're talking about months here. And I think it really does a discredit to the early childhood profession, where states just come in and say, hey, all those regulations and all that paperwork you've struggled with for all these years, we're just going to waive all that. And any mom or dad or grandma can just open their own program. That's not the right approach here. And I think we need to come out as a community and be strong that no, especially now in this time of trauma, in this time of mental instability, in this time of behavioral health, childcare needs to be quality. We need to make sure that we're getting those kids, the best we possibly can to help get them through this time. And we need to make sure we're protecting the health and safety of the kids, because the stakes are just so much higher. So, while I understand why states are doing that, in some cases, I think they're going a little bit too far and waiving some of these requirements. And I think if they're going to continue to do that, then when this is all over, again, we as a community have to ask the question, well, how come it was okay to waive all these rules and regulations and all this paperwork for 6 months that you made us live under for decades? And as we come back to a new normal, maybe we need to re-examine some of these requirements. And the same discussions are happening now with medical providers and with pharmacies and everything else. Pharmacy is an interesting thing. 95% of the population lives within 5 miles of a pharmacy. And every time there's a public health emergency, we're asking our pharmacists to step up to the plate and give vaccines and give shots and counsel and give medication. But as soon as the emergency goes away, they pull all that authority from them. So the question is, if they're good enough to do tests and give shots and advice and counsel patients during a time of crisis, why aren't they good enough to do it on a normal day-to-day basis? And I think for many sectors, that's going to be the discussion we have to have when life gets back to some sense of normal here.
All right, I agree. And I think the other thing to really think about is, as an industry, we've really struggled to be seen as professionals. And we've really struggled for the world to just recognize us as professionals. And if states like Nebraska, that just really, it kills the momentum that we could have right now. It just completely takes it away, and it devalues the work that we do. I mean, so much for best practices, right? It just really devalues that. And it just says, well, anybody can do this work. And I'll tell you, I've made a career on buying centers from people who thought that this was an easy field to go into. They've opened up a childcare center, and then in the future we're going bankrupt because they realize this isn't such an easy field. So it just seems like that will encourage those kind of people who think, oh, I'll make a ton of money. My childcare center charges, $200 per child. I can make a fortune. And how many people are just going to go try to open one up now because it's easy? But that really devalues us as professionals. So that's definitely something I would say.
I agree. And it totally reinforces this perception that, we are just babysitters.
Yes.
And that is not the case. This is early care and education.
Yes.
Every study out there shows the big, magnificent difference that 0 to 3, 0 to 5 the group makes. I mean, if you miss 0 to 3, you're going to have detriments for the rest of your life. And I think now is the time not to be relaxing restrictions, but rather looking at the states that don't have quality ratings and quality improvement systems. Absolutely. And saying, why not? And with all this money coming into childcare right now, some of that money we should be going towards quality. We don't want to rebuild just to the level that we were at. We want to rebuild above and beyond and make sure we're incorporating all of those standards and all those best practices to make children who are going through this, because there is going to definitely be a deficit. We're all going to have some kind of mental stigma about this for the rest of our lives. So let's make sure these programs are using this money and coming back in a way that's really enhancing the quality.
I totally agree. I 100% agree with that. We do really need, if we want to be seen as a profession, we have to act like it. And holding us to higher standards, I am all for that. I think that just will make us a better industry as a whole. And I think what a lot of owners don't always understand is those higher quality standards actually do make you more profitable. And it really does, in turn, it keeps your center full. It keeps you at a higher rate. It really actually does not just make you provide better outcomes for the children, which is what we should all be focusing on, but in the long run, it makes you more profitable, which means you can pay higher salaries. It really does have a great trickle-down effect. So getting back, though, for the centers who do remain open, is there anything they can do to keep the children and their staff safe immediately, like any immediate steps they can start taking now?
Yeah, absolutely. I'm glad you came back, because I was going to come back to this too. I think it's really important. So yes, there are definitely some things that you can do to help keep yourself a little bit safer. And again, the magic bullet right now is if parents have the opportunity to keep the kids at home, that's the safest thing that we can do. So for those parents that can keep kids at home, I would encourage them to do so. What we're looking to do really is limit the amount of contact we have with individuals, and that includes kids. So the smaller your ratios can be, the better. I've seen some states actually mandating. Ohio is down to 6-1 now. Virginia, I think, is 10-1. The smaller you can make those ratios, the better. So if you can go down to 4-1, 4 kids to 1 adult, that's fantastic. I think the other real key to success is keep the groups together. So, if you look at the article, one of the things I recommended is we have so many closed, libraries and convention centers and sporting stadiums and K-12 schools that offer a much larger footprint than most traditional childcare programs do. I'd really like to see partnership with the local government, who owns many of these buildings, to allow us to use those, because you're going to have more square footage and you're going to have more opportunity to spread people out. So keeping the groups separate, if you have one teacher and 4 children, that's your Corona buddies, and that's who you're going to be with for the rest of this pandemic, right?
Right.
So the 4 of you are going to be together. You're going to go to lunch together. You're going to go get your food and eat it together. You're going to go outside together. You're going to hang out and do everything. We're not going to be mixing up groups. So I don't want to see everybody going to the cafeteria at once and all eating together and all that. That's not a good practice right now. Right. In the same token, thinking about the number of programs that before this used to allow parents to come into the front door and go all the way back into the classroom and drop the kids off. That's got to stop too. We really don't even want the parents coming into our door. So you got to figure out a way to start doing, pick up at the curbside. Same thing with essential people coming in, like deliveries or service members or people coming in. If you have a package from Amazon that's arriving, have that driver leave the package outside and get it later. There's no reason to have people entering in and potentially introducing more, virus or more contamination into your facility. For sign in and sign out procedures, I would take that now, and instead of having the parents sign in and out, just have a staff member, because we know that this stuff can live on surfaces like, pens, like cardboard, like glass, stuff like that. And what I'm worried about is, how many times does somebody have a pen or a pencil and they're putting it in their mouth and they're doing all this nasty kind of stuff. So I don't want you sharing pens. I don't want you sharing tablets. I don't want you sharing keyboards. I think for now, you as the the teacher or the child care provider can sign the child in and sign them out. The parents don't need to be touching all that kind of stuff. Also, spread the kids out as much as you can. So if you're doing nap time, spread those mats out. Instead of going head to head, flip them up so they're head to toe. That way they're not, breathing on each other. If you've got cribs, space those out as far as you can. In terms of, play activities, it's tough. It's tough to keep, kids from putting their hands in their mouths and playing with toys. But look at toys that are solid. Look at toys that can easily be cleaned. I would not be playing dress up right now because clothing is hard to decontaminate. Right. In the same way, I wouldn't be using sensory tables like water tables and sand tables. Again, very hard to decontaminate. Going outside is a big point of contention right now. If you were to take the hard line on the guidance, we would say that you should not be using outside playground equipment. It's too hard to decontaminate. Kids, again, their hands get dirty. They're touching surfaces. Multiple surfaces get touched a lot. So a lot of programs are figuring out creative ways to go outside and do programs that allow for social distancing. Getting kids their own, colored pencils, their own chalk, their own crayons, so that they're not switching those materials with others is a great idea.
Okay.
Also, in terms of just, and same thing in terms of food delivery. We've talked a lot about that in the guidance too. Preparing meals on site versus catering in versus bringing from home. I think the best thing is not to have meals brought from home right now. Again, we're worried about contamination coming into our program. I think it's much safer to either prepare meals on site where you can actually know what's going on and make sure people are following hand hygiene, washing their hands and all that kind of stuff. Or if you have a trusted, reliable, vendor or caterer or out of a central kitchen that, again, has went through the basics of food safety to get, certified by the local health department, that's going to be really good. Fortunately, the transmissibility on food seems to be very, very low, if at all. So food still, thankfully, is very safe. But we can't neglect those, elements of hand hygiene and just essential food safety practices during this time too, because we don't want to fall back on those. So, those are some ideas. There's obviously again, we got a 28-page document that lays out stuff in a lot more detail, and it's a starting point. We're learning more about this every day, and so take it, look at it. If you can use it, great. You'll probably have to customize it a little bit just based on your area and some of the rules or emergency rules they're putting in place. But if you can get access to those bigger facilities and do so either with your emergency management agency, your local health department, or your licensing facility, I think that's really the key because, again, we want to keep people spread away. We don't want people sharing a bunch of stuff. So the more you can stay away from each other right now, the better it can be. So the challenge to everybody out there is, how do we create games? How do we create activities? How do we create fun stuff to do for the kids that encourages social distancing, and not going up and touching one another?
It's so hard for a 2-year-old to tell them, and just, I don't know, when you have a good quality program, you're nurturing, you are giving hugs throughout the day, you're those pats of affirmation. And right now, having to keep really not do it's it is so hard because the quality states that, we need that human touch. But right now, we don't. So it is a really, really tough situation. So is there a timeline that you would suggest putting all of this into place? Like we were talking about before, how I was telling you in my city, we don't have a single case. If I were to start a lot of this now, and ironically, a lot of it I do actually already have in place, which makes me feel better. Is there a timeline that you would recommend it?
Well, I think the sooner the better. And these are, these are procedures and policies that may stay around for a while. I don't know that we're going to go back to handshaking like we used to after this. I mean, I still know people from 9/11, which has been, 19 years ago now, that won't fly on an airplane. So I think we're going to have, and I think about my grandmother who's in her 90s and went through the Great Depression, and how she's always, clean your plate and hoarding stuff and not throwing stuff away. But that's because that's what that generation went through. So I think these are going to be long-lasting things. I think certainly now the messaging out to your parents should be easy and say, look, we're committed to staying open to care for your kids, but we want to make sure we're doing this in as safe as way as possible. And while we don't have any cases yet in our county or in our area, we know that there probably are cases, but people just haven't been tested. I mean, there's a huge backlog right now on testing. And unless you're actually admitted to the hospital and really in the ICU, the people that are doing drive-through testing and others, in some cases, that's taking 7 to 10 days. So they're definitely, I think we just have to assume right now with the asymptomatic people, the people without symptoms, and the backlog and the lack of testing that's available, we have to just start assuming that everybody is infected and treating it that way. So we're going to put these policies and procedures into place. We understand it's a little bit different, but parents, we're doing this because we're committed to you. We're committed to the safety of our staff and of your children. And the biggest thing is we want to be able to continue to provide services. And if we get a case of coronavirus in here, we're going to have to shut down.
Right.
And there's not a really good answer about when we can open. It could be 48 hours or it could be 2 weeks. So in order to keep us and our business viable, we're going to have to take these steps, and we hope you understand that and appreciate that. And we hope that you'll work with us, to do this. So I think the time is now if you haven't done them. And again, I think you'll find hopefully a receptive and friendly audience with the parents, just understanding that we are trying to do the best we can do in these unprecedented times.
So the only thing I've had pushback from parents on, they don't like the drop-off procedures. We were allowing them into my lobby, but I like your idea better of not even letting them in the door. And I would have a staff member take them back to the classrooms, and and I was only allowing one parent in and out of the building. So I wasn't, if mom was the drop off, she was the drop off and pick up, and it had to stay her consistently. And that is something we got a lot of pushback on. The parents did not like that a lot at all. And so I think it's just important for us to really just stand our ground right now. And I know there's going to be things that we have to do that are unpopular. It's just what we have to do right now. Sometimes we just have to take that hard stand.
Well, and sadly, all you have to do is go to Google and type in childcare provider sick with coronavirus or infected with coronavirus or childcare program shut down coronavirus, and you'll see cases all over the country. So, it's not like we're trying to be, induce panic. We're doing this because it is happening, and it's happening all over. And as we see, frontline medical providers, I mean, I think one of the things that Governor Cuomo said was like 20 or 30% of the cases in New York were coming from medical providers who are getting infected. Yeah. And think about that. I mean, these are folks that have the protective equipment. They have the masks and the gowns and the gloves and the training, and they're still getting, sick with this. So I don't want us to be lulled into a false sense of security here. We are very much at risk. We are very much doing this, and we should be getting hazard pay, by the way. Right. And the parents, I think, just have to understand these are not normal situations. And if they want the continued availability of the services you provide, they're going to have to be compromised in some way.
And
by the way, from an active shooter perspective, this is like a dream come true, because I don't want people going in the program anyway. We always talk about access control and keeping people out. So, I'm kind of hoping that this stuff sticks around a little bit, because we'd have far fewer domestic disputes. We'd have far fewer school shootings and other things if we could start really getting better and secure about this access control stuff.
Oh, that's a really good point. And I think that leads to the next topic we were going to talk about is when life turns back to normal, which I don't really think will ever be the same after that. But I think that can be a good thing. I think there are some positives, like what you were just saying, that can come out of it. What are some of the other things that we'll be facing and some changes that you think, what new issues do you think we'll see, and how will ECE change after this?
Well, I think first and foremost, we're going to have to review all of the contracts that we have with our parents, because so many folks have been caught flat-footed now and essentially on a contract that if your kid doesn't show up, the parents don't have to pay. Mm-hmm. And that spot that you have in your program is valuable. There's a lot of childcare programs that have long waiting lists. In fact, pretty much every childcare program I know has got a waiting list. Right. So I think we have to, again, as a community, just like we would retain a lawyer or whatever, we have to add value to that. So we are having spots for your child, whether or not we can operate at no fault of our own. We're holding that spot. So when we do reopen, your child has a place, and there needs to be some kind of monetary assignment of that value. So I think that's one thing. We're preparing now. We've got our online training that's in English and in Spanish. So if you go to our website, we've got everything in English and Spanish. You can go there, look at our resources that are free, and we've got a great active shooter. We have a great active shooter training program too, but we have a great coronavirus training program in English and Spanish that's put together by healthcare professionals, public health officials. But, I think the value of online learning is certainly something that we're going to have for a while. But the big thing we're seeing now for our training, and what we're actually working on this week, is starting to get online courses available. So when we do start to think about reopening, behavioral health, how do we identify the issues? How do we talk about these issues? How do we message this to kids? How do we make kids, feel safe again? That's a course that we're putting together with our staff, and we've got great child psychiatrists and stuff that we work with. So they're putting that together. And then the other big one that we're putting together now is how do we clean? How do we sanitize? How do we disinfect? How clean is clean to finally say, okay, I think we're ready to reopen. So those are the two things I think we're really going to be seeing over the next 6 months. I am one of those people that do think that we're going to probably see this come back around in the fall and maybe mix in with the regular seasonal flu. So I do not think we're out of the woods on this yet. I think it's very likely that life will not get back to normal till next year. And I think that many folks haven't really faced that reality yet. And I will say, as a public health guy, some of the messaging around this, we've gotten it completely wrong. And it's not a blame game. A lot of the data coming out of China was just incomplete or inaccurate. Yeah. And I think, the president in particular, I don't envy him in his situation, but I think the 15 days to stop the spread, everybody from a public health standpoint understood it wasn't going to be 15 days. Right. If we can start to reopen programs by June or July, I think that's a real success. But again, even if you get the green flag and say, okay, reopen tomorrow, who's going to be the first person back on a plane? Who's going to be the first person back at a sporting event or a concert or a wedding or a funeral or these big gatherings? There's a lot of stigma that's going to be associated here. Again, I know people from 9/11 that won't even get on a plane, and that's been 19 years. So I think we're going to see similar things in this vein as well. And I guess the challenge is, how is that going to impact early childhood? CDC came out with new guidance on March 31st, and they basically said, if you can get access to a lab coat or an apron or even just a heavy kind of button-down shirt, maybe you should throw that on before you pick up a kid and before you, are making close contact. So you put on your coverall, you put on your button-down, then you pick up the kid and, give them that one-on-one attention. And then when that's done, you take the coverall off to kind of keep some of that virus off of you. So it's kind of these things that I think we're going to be thinking about it. In my emergency preparedness class, I have this great thing. As a public health guy, we talk about food safety and sanitization and decontamination and disinfection. And I have this glow gel, and I make people put it on their hands. I don't tell them what I'm doing. Yeah. It just looks like a lotion. They put it on their hands. I tell them to go wash their hands, and they come back, and I shine a black light. And you should see the way their hands light up. They didn't do a good job at all. Right. And it's funny because I've heard from so many people like, hey, remember in class when you made me wash my hands? Like, thank God you did that, because now I know that I wasn't doing it right. Right. So, I think the hand washing is going to stick around for a long time. I don't know what happened with all the toilet paper, but that's probably something that'll stick around too.
That's just, people are desperate for control. We cannot control the situation. So hoarding things like toilet paper is a way that people feel like they are taking control of an uncontrollable situation.
And I was so lucky. I gave the keynote at the New Jersey Child Care Aware of America or Child Care Aware of New Jersey conference. I guess it was last fall. And one of the things they asked me to talk about was preparedness. And I talked a lot about continuity of operations. And I think people, when I talk, people always think I'm kind of crazy and I'm, like a prepper or something. But I've gotten, again, a lot of emails like, hey, thanks for talking about those topics. But, right. One of the things was continuity of business. And so many businesses, can't cut checks unless they're physically in the office. Yes. Or you need a check with two people to sign. Yes. So many businesses don't have laptops and they only have desktops. And I was telling people, like, what if you couldn't go to work for 3 months? How would you survive as a business?
Right.
So thinking about that from our child care resource and referral angle and certainly in early childhood and stuff is important too. So hopefully when we come through the end of this, I know there's going to be a boatload of money. There already has been. Head Start's getting $750 million. $500 million is going to summer programs, and then $250 million is going to help respond. And part of that response is, increased training and mitigation of the pandemic. So I'm really hoping we can start to get more serious about planning for emergencies. All 50 states by the CCDVG, Child Care Development Block Grant Act, we're required to have emergency plans that address continuity of operations and continuity of child care. And I think we really have to look hard to see, hey, out of those 50 states, who took that planning requirement seriously? Because I'm guessing a lot of states right now are saying, wow, we were totally unprepared for this. So I'm kind of hopeful that those kind of things and what we do every day and what we have been doing start to get more ingrained, because it does make people prepared. And the lessons we're learning now, by the way, can be applied for tornadoes, earthquakes, floods, fires, whatever. Yeah. So it's all good stuff.
That's one of the things I keep saying too, is the only difference with this emergency is that we're all in it together. But honestly, we see different emergencies. They're just usually in certain areas, but now it's happening to all of us at once. And that really is the only difference right now. And I do think that we can emerge better from this. I really think that if we take this opportunity, which again, I'm going to plug advocacy. If we want to shape the way things go from here, we have to have our voice heard. And so the more of us who are calling our congressmen, making sure our voice is heard, I've even gotten on local news to make sure the governor could hear my voice in this. And if all of us are really advocating like that, we can make a change in our industry, and we can also get that recognition we want so badly as being seen as professionals. But we have to have our voice. We've got to be heard.
Yeah, 100%. This, literally, hopefully only comes around once in a lifetime. But if we're not, capturing these stories and capturing the huge difference that we made to help those frontline professionals do their job, I think it's a tremendous opportunity missed. And I really, really hope that we don't go back to, just being seen as the invisible workforce that's making, in many cases, $9 or $10 an hour. It's just not fair, and especially when you look at the way that, again, Head Start, Early Head Start, K through 12 has handled the situation. Childcare needs to come together on this. So I would encourage you, yes, much like you're saying, reach out to your representatives, work with your local organizations. There's a lot of them at the state level. The EYCs, the ACs have been really good.
Yes, they're fantastic.
I'm sure they'll continue to do so.
Yep.
Yeah.
Yeah, and I'll provide a link for any EYC, and then everybody can find their local chapters, because they do some great work, and that is a great way to get involved. Just right now, they're really advocating for us, and so that is a fantastic way to get involved. Absolutely. Well, thank you so much, Andrew. I think you've brought us a lot of really great information. I know I'm going to pass your name along to Nevada's AEYC chapter, because I think you would make a great keynote for us here in Nevada. So we actually just had to cancel our national conference. It was supposed to be later this month. So, but you know what? Now I think everybody's seeing things through a different lens, which I think is a good thing. We can choose right now how we're going to emerge from this. And we really can turn this into a positive if we choose to emerge stronger and really just rise as leaders. So it's something I'm really encouraging people right now. But thank you so much for taking the time out. And would you like to add anything?
Well, I just really appreciate the opportunity for everybody that's out there on the front lines. Thank you, thank you, thank you. I don't think we can say thank you enough. You are helping your communities. You are helping on the front lines of this battle. You are essential personnel. You are our heroes in many ways. And I want to make sure you get the credit you deserve and the pay you deserve. But ultimately, I also want to make sure that you're staying safe and your families are staying safe. I do know that we're going to get through this, and we'll do it together. Life will come back to some sense of normalcy. I was talking with the Florida chapter of the EYC earlier this week. I am going to do the keynote down there in October at the Florida AC, if it can happen. So I'm happy to join me down in Florida. And I believe that's going to be in Jacksonville in October. We'll also be at the Region 2 Head Start meeting down in Puerto Rico in November. So, people are starting to plan. Right. I think we're all going to be very excited when all these, things get over and we can all get back together. And I would encourage you now to be thinking about those questions, to be thinking about the difficulties, to be thinking about the struggles and writing that down. Because one of the things we'll be doing in Florida and in Puerto Rico is really bringing together everybody to have what we would call in the fire department is a debrief.
Yes.
What went well, what didn't go so well, what we need to do better for next time. And I want the entire community to be a part of that effort so that we can think about, how we can really make plans that are more actionable and more operational to keep us safe, because this will happen again. And
right.
It may just be a hurricane, it may be a flood, it may be an earthquake, or it may be another pandemic.
Right.
But it will happen again. And we need to take the time now to capture these lessons to help keep everybody safe. So thank you so much again for letting me come on. I hope this has been helpful to folks. Please check out our website, childhoodpreparedness.org. We're on Facebook. We're posting stuff daily. So facebook.com/childprepared if you want to see us there. And we're always here for you. So thank you so much. I really appreciate the opportunity to come on today.
Thank you so much for all the useful information, Andrew. I will post a link to Andrew's website in the show notes, so be sure to check that out. And be sure to join the conversation on our Facebook group, facebook.com/childcarebusinesscoach. I will also post a link to my Facebook group in the page. So join me again next week for more information on how we can get through this time. I will just keep giving you information to help you get through this time. And I do go live on Facebook almost every day. I'm down to about 3 days a week at this point in order to just bring you hope and encouragement and some information that you can use every day at your childcare center. Have a great rest of your week.